This is the lab at Children's. This is where a lot of like the basic testing and stuff goes on. We take and we look at the sort of inside of a patient. We look at their blood, we look at their urine, other things, and we're telling the doctors what they can't see on the outside.
We're kind of like investigators in a way.
When a patient walks into the ER, they don't really know what's wrong. I mean, you can see if they have a broken bone or something physical, but if they're just like their stomach hurts, you don't know what the cause is. So the doctors order the tests and taking a guess on what they think it might be, but then the tests come back and they can really like make a definitive diagnosis.
We give them all that information so they can make, an informed decision as to how to treat the patient.
Behind the scenes heroes. Hi, my name is Lauren Beatty and I'm a medical laboratory scientist here at Children's Medical Center in the core lab. There's a lot of areas to the lab. It's really essential that everyone works together. This is the tube station.
My name is Nick Dooley. I am the lead lab support specialist here. Samples are collected from kids such as blood, urine, various body fluids. The nurses, doctors will collect and then send it to the lab via the tube station. What it does is helps nurses on the different floors actually send it to us rather than walking into the lab.
Once it gets down here to us, it's opened up, we look at it, we make sure things are matching, making sure if they sent down something for a urine that they didn't just give us blood.
This is extremely important because we actually touch all the samples that actually come into the lab before they get tested on.
They take it and they dispense it all over the lab. They take it where it needs to go. This is the core lab.
This is where we run all of our chemistries and our hematology samples.
If it's chemistry, we set it on our machine. If it's hematology, we're looking at it, we're running on our machine. We're taking a look at the slides on the microscope, making sure things look normal. This is microbiology.
Hi, my name is Janet Schuler and I am a medical technologist in the microbiology department. We are basically testing for the different types of bacteria. Let's say that a patient has some kind of a wound, and that wound we use a culture swab and we swab that site. That swab gets sent to the laboratory. We process it, we set it up on different kinds of media, which is basically what I have here. Each particular plate has something that we need in order to be able to identify the organism. For example, this is what we call a blood plate. Well, a blood plate has many nutrients in it, and it will allow and enhance the growth of that organism. This particular organism right here, that's probably a Staph aureus. This is a urine culture and it's probably some type of strep. We do testing so the nurses and the doctors will know how to treat those different infections that the patient might have.
This is virology.
Hi, my name is Susan. I am a medical technologist in the molecular and virology department at Children's. In this area of the lab, we are looking for viruses. We can put them in cell culture or we can look for them directly on a DFA.
And this is the blood bank.
Hey, my name is Heath. I am a medical technologist here at Children's, work in the blood bank. We set up blood for transfusion for kids who have low hematocrit, hemoglobin, or platelets, or that need plasma products. Their specimen of blood will come down to the blood bank, we'll log it in, and then we'll spin it down the centrifuge. That'll give us two parts, it'll give us the plasma part and the red cells. Most of the samples will go over here on the Probi machine, and that's the automated part of blood bank. If it's complicated, or if there's a problem, or if it's a neonate, it'll go over here on bench and it'll be done manually. We see a large number of the patients, especially when they come to Children's, if they're in the ICU or if they're CCBD kid, they'll definitely probably get blood from us.
The hospital could not run without us here. It would essentially almost be leaving the doctors a little blind.
I enjoy it because I love it. I make a difference. I make sure that these kids actually get these results in a timely manner and that they're accurate as well.
I've been doing it all for many, many years. I would not want to do anything else.
you're making a difference, but you're not necessarily on the front line. I love my job.